health as a primary focal point for any responsible government. It is on this foundation that every other development becomes enjoyable. Governor Yahaya Bello places a high premium on the health of the people of Kogi State with no recourse to how much funds it will demand. Driven to reduce the maternal and child mortality rates in Kogi State, the administration of His Excellency Governor Yahaya Bello conducted series of significant health service weeks on maternal, newborn and child health intervention across the 3 senatorial districts in the state. The free health intervention varies from HIV testing services, antenatal care, malaria prevention, family planning services, health promotion, nutrition assessment, vitamin A supplementation, deworming, routine immunization, birth registration, and long-lasting insecticidal net distribution. These services were made available at the primary health care centers, the PHCs in the state, and has yielded significant results.
The training has been of tremendous impact, especially for the fact that we know that nobody can offer what we don't have. We now have health workers in hard-to-reach communities at the rural areas who are able to carry out certain emergency interventions without waiting for the consultants.
The governor went ahead to initiate the Governor Yahaya Bello Healthcare Plus, earning Kogi State a seat as the state with the lowest infant mortality rate in Nigeria, according to a November 2019 study by the National Population Commission and the Federal Ministry of Health, sponsored by the United States Agency for International Development, the USAID. This was achieved by his collaboration with the Saving 1 Million Lives initiatives. To this end, maternal mortality has been reduced to less than 100 per 100,000 and infant mortality to less than 10 per 1,000 live births by the year 2019. About 332 primary healthcare centers across the world in Kogi State were fully renovated and remodeled for proper usage in delivery of healthcare services to the locals. Governor Yahaya Bello constructed and furnished a nutrition house for accelerated nutrition results in Nigeria and to quicken the delivery of nutrition services to the malnourished children in the state. For a state with a population of over 3.5 million people, Kogi State was rather lagging behind in responses to emergency health cases due to a lack of ambulances. Now, Governor Yahaya Bello, in collaboration with SDG, purchased 12 state-of-the-art ambulances which were distributed to local governments' health centers across the state. The Kogi State health sector recorded a remarkable feat as the Ministry of Health equipped 5 selected public hospitals across the 3 senatorial districts with state-of-the-art medical equipment, peak performance theater equipment, essential drugs, and premium quality diagnostic apparatus of international standards. The Governor Yahaya Bello-led New Direction Administration remodeled the Confluence Advanced Medical Diagnostic and Imaging Center, Lokoja. The Governor established the Kogi State Sustainable Drug Supply System, the SDSS Committee, a mega drug distribution system which has eliminated the out-of-stock syndrome which existed in time past. An electronic data tracking system was introduced to track drug consumption and utilization at health facility level. The New Direction Administration also established the Public Health Emergency Operations Center, specifically built and equipped for the coordination of emergency outbreaks response in the Ministry of Health. Now, taking it a step further, Governor Yahaya Bello assented to the bill for the establishment of a reference hospital in Okene, which was passed by the State House of Assembly, and immediately he released funds for the construction to begin. When completed, the reference hospital will be in a class of its own as one of its kind in the northern parts of the country. Simultaneously, there is an ongoing construction of a state-of-the-art specialist hospital in Gegu and a total uplift of the Kogi State University Teaching Hospital to a specialist hospital standard in Ayingba. All 3 mega projects have been funded and ongoing at top speed. With Governor Yahaya Bello's priority on health and in the spirit of the Let's Do More mantra, His Excellency inaugurated a steering committee for the implementation of the Basic Health Care Provision Fund. The Governor further released the sum of 100 million naira bond amongst other requirements to participate in the program. With a heart given to the plight of his people, Governor Yahaya Bello launched the Emergency Transport Scheme, the ETS, for pregnant women and signed an MOU with the National Union of Road Transport Workers Kogi branch so as to ease the transportation of pregnant women from rural areas to the designated hospitals. Kogi State flagged off the distribution of Kiwi Complete Vacuum Delivery System to public and private health facilities. Now, Kiwi is an innovation that is suitable for the environment as it requires no electricity or any form of energy, and since obstetricians and gynecologists prefer vacuum-assisted delivery (VAD) to forceps delivery, this comes in handy. This equipment was distributed to tertiary health institutions, both publicly owned, including the Federal Medical Center, and privately owned. The distribution was meant to advance the state's target at further reducing maternal mortality rates per live births. The governor also flagged off enrollments of beneficiaries into the Kogi State Health Insurance Scheme. The benefits of the Kogi State Health Insurance Agency includes reduction of user fees, which constitutes a major barrier in assessing healthcare needs at the point of service delivery. It helps to provide financial risk protection and strengthen health system of the state.
No one should suffer or die because he or she cannot access or afford health care.
Over 2.1 million free LLINs were distributed, plus additional 300,000 MNCHW antenatal clinics to indigents and residents of Kogi State, 1 LLIN per 2 persons. To further improve the sector, the governor recruited over 2,424 health professionals across the state to fill the manpower gap in the sector. Worthy of note is the fact that 28 indigents of Kogi State have been sponsored by the government for surgery outside the country, including the separation of Siamese twins in India. To boost the study of students of the College of Health EDA, the governor constructed 3 academic blocks, authored a modern clinic, renovated and supplied laboratory equipment for the institution. In 5 years, the governor has revitalized no less than 239 primary healthcare centers, 1 primary healthcare per ward, whilst also facilitating the procurement and distribution of essential drugs for treatment of common childhood illnesses to over 300 healthcare facilities across the state. The Bello Healthcare Plus has attended to over 2,000 indigent pregnant women in the healthcare facilities across the state. There is no doubt to the dedication of Governor Yahaya Bello to the health of Kogites, as in 5 years he has left no stone unturned in this regard. The aforementioned are recorded statistics and data, but countless are the unrecorded personal aid given by the governor to hundreds of thousands of Kogites across the state in his determination to ensure that Kogites lead healthy lives. In fact, he made it a principle in his cabinet for none of his cabinet members to turn down health-related requests from Kogites.
Good evening, everyone. Viewers from across the country. I think tonight I'm one of the most happiest person watching these videos. It shows how serious our leader, in particular the Kogi State leader, are in terms of executing some of their primary roles and responsibility in the state. Without any iota of doubt, I am proud to be a Kogite. I am proud to be identified as a Kogite who breathes fresh air coming out of this state. And I must confess also that the administration of Alhaji Yahaya Bello from inception has prioritized the health sector in Kogi State. This is one of the reasons why for some of us who have been following his activities from day one and remain keen and believe in his mandate to lead our state, and also subsequently if there is any other assignment, he needs to step up and take charge. In recent time, we have seen the leadership wisdom and foresight that our governor has exhibited, both at the state level and also at the national level. Before even the advent of COVID-19, Kogi State are at the forefront of tackling a lot of similar cases such as the yellow fever. You can see the way at which the Commissioner of Health under Alhaji Yahaya Bello was able to curtail the dangerous yellow fever within some few Um, Hello. So, one of the things Governor Yahaya Bello did, as I was saying earlier, sorry, before the interruption, is to make sure that immediately he came on board, he improved primary health care across the 21 local government so that they can easily attend to such cases. This is a leader who has foresight, who understand that you need to put machineries in place just in case something like this happen, and he did that. And if you notice, after upgrading over 200 primary and secondary healthcare centers across the state, that will prompt even the government to hire more staff, creating direct and indirect job for people that are ready to tackle such cases. And that was one thing that gave us an edge during the COVID-19 case. We already have the manpower, people who are available on the ground for such scenario. Because from the experience, from the Lassa fever experience, from the yellow fever experience, we already understand how to curtail such viruses. And that is exactly what Yahaya Bello did immediately he came on board. He made sure from healthcare to security to education, he made sure that the infrastructure to handle and tackle such kind of cases is being put in place. And I must confess, you must give him a kudos. Notwithstanding the infrastructure that is going on across the three senatorial districts, from the reference hospital in Okene to the teaching hospital in Anigba to the extension of the Kogi State Specialist Hospital. This is what it takes to lead. You must show capacity whenever you are called upon, and Governor Yahaya Bello has shown that capacity. Thank you very much.
See, for me, I count this as a very
Sorry, my second who is supposed to continue from where I stopped. I wanted to give other audience opportunity to also talk about the government and the leadership of yeah, Adoza. It's back online. Let the opportunity to also say one or two things about what you observed so far in the health sector in Kogi State. Thank you.
good, good evening to my fellow participants and listeners. For me, I must commend the government of His Excellency Governor Yahaya Bello. We can practically say that it is a new dawn in Kogi State and the health sectors vis-a-vis other sectors. Because if you see the pragmatic leadership provided by His Excellency in Kogi State, you will agree with me that you don't have a reason to worry. One of the things that for me as a person, I will not waver to say anywhere in the world is his security index, his performance in that area is why every other thing is going on in the right manner and direction. When you talk about his performance in the health sector, you cannot take away the fact that this man has earned the confidence of the people and investors, even though majority of the investment in the health sector is government driven and not really private. The investment is massive. You have a whole lot of hospitals of a reasonable quality going on across board in Kogi State. As far as the issue of upgrading our health system is concerned, you have to give it to Kogi State. By the time all the projects that are ongoing in that sector are completed within the shortest possible time, I bet you that from what we have seen, at the same time, what we have heard the governor say so many times about that very development, most people will not have any reason or cause to embark on medical tourism. Kogi becomes that state with every necessary facility to give you what you are going outside Nigeria to look for, which is very commendable. Another thing I think we should do or we must do as a people at this time is to come together and give the needed support that this government deserves so that the dividend of democracy that he is putting forth can get to people promptly and henceforth. We should embark on things that are going to be major distractions to the government that will not allow what we are doing or what we are experiencing to continue. We are experiencing peace, tranquility. We are gradually gaining prosperity in all ramifications. And except you want Kogites and by extension residents in Kogites in Kogi State to be very angry with you, don't try to be somebody who orchestrates any form of distraction that will affect what His Excellency is doing in Kogi State. I wish to digress a little from because my other participant or my friend had really spoken about extensively about the health sector and the development going on in the health sector. I want to use this particular opportunity to greatly commend by way of digressing from this issue around the health sector. Commend the governor for his security strides. Kogi State, as you all agree with me, is a state in the middle of the country where you have so many states, about 90 states, bordering Kogi State. Yet, the level of insecurity you experience across the country, across the length and breadth of this country, is very different. The stories are very different when it comes to Kogi State. It's not as if we don't have pockets of insecurity very once in a while, but you cannot take away the proactiveness and the will to surmount all criminal elements and the antics they usually come up with anytime they try to demonstrate that evil within the shores of Kogi State. So on this, I feel this alone has given all Kogites, or most Kogites rather, progressive Kogites, the reason to stand tall amidst other state patriots. And this, we wish to commend our governor and pray that God will continue to give him the needed wisdom, zeal, and will to continue to provide these robust rights in the security department of the state. Having said this, I will vacate the floor so that the next person can actually join us.
Thank you very much. I think, just like you have said, without any iota of doubt, Yaya Bello has won himself the most proactive governor uh, so far, since because he has shown capacity, he has shown wisdom, he has shown that he is a leader who can who knows what he's doing, who knows how to cut his onions. You can see how he has been able to manage the security challenges in Kogi State. You have seen how he has been able to upgrade the long years of educational decade in Kogi State. You are seeing what he's doing with the health sector in Kogi State. It only takes a leader who has wisdom, who has political foresight, and who has the will. Because one thing I come to realize about Nigerian leaders is sometimes they have the idea, but they don't have the political will. And when you don't have the political will to bring to life some of this idea, it will just be there. It will just be an idea, a mighty idea that will not yield anything, that will never grow. It will just be you saying that, oh, you once have this an idea, but you don't have the political will. But you have a man who has the political will, who understand what he want to do, who understand, who due to his years of experience both in public and private sector, he understand the plight and the plight and gain of what is it called, being a citizen of this country. And that's why immediately when he came on board, he said, no, this is not how it is being done. It is not free lunch again. This is it, this is what we need to do. And immediately he started from the teaching hospital in Kogi Western Central District, from what is it called, the one we are seeing now in the Kogi Central part of the state, the reference hospital, the extension of the Kogi State Specialist Hospital. It only takes a leader who has wisdom and political foresight to implement all of this. And let me tell you something. Kogi before now used to be a what is it called, civil servant state. Now, with an enabling environment and atmosphere for private sectors to operate, even within and outside the health sector, you are now seeing people coming in more private, what is it called, hospitals as established in the state, because they now have an environment to operate, and direct and indirect job will be created in the private sector. It always takes, once again, it always takes a leader who understands what he's doing to be able to do all that. And of course, when we are done with when the governor is done with the reference hospital and also the extension of the specialist hospital and the teaching hospital, more jobs will be created. This is what we need. This is what we have been saying. This is what we have been yearning for. Just imagine governors before now have done this. Yahaya Bello will not be thinking of reference hospital again. You will not be talking about extension of that hospital again. We will be talking about bigger thing in the health sector. But because we do not have the opportunities to have the sort type of leader that have the political will, that is why we are here today. But thank God, we now have a governor who is proactive. We now have a governor who knows what he's doing. We now have a governor who has a health template, how he wanted to operate from primary, secondary, and even the what is it, tertiary part of the health sector. He understands the game. And I must confess, we are lucky to have Alhaji Yaya Adoza Bello as one of us, and as a leader and as the piloter of this great state. Thank you very much. And God continue to guide, bless those who are leading on in their own respective, what is it called? Um, ways. Thank you and God bless you.
Before, one of the things I want to say before probably calling it a quit is that if for no reason, if every other governor in Nigeria are really concerned about the assignment before them and actually in love with the people, I suggest, and I've said it before now and I'm saying it again, they should all endeavor to borrow a leaf from the pragmatic, proactive security governor of Kogi State. Enough of this endangering people's life. We cannot understand. You may not like the youngest governor, but you must give it to him. What he's doing is obvious, very visible. So even if you don't like him, do that because of the people, the lives and properties of the people that are under your care. This man has demonstrated enormous understanding of the system. The will is there, the political will is not in doubt. And this is why we are calling on Nigerians that there will be reason to replicate what is going on in Kogi State, particularly as at today, our biggest problem is the issue of insecurity division. We need to be unified. We need to be unified. We need to be secured. We need to be unified so that we can all prosper together. This is the agenda. So every other thing for me and to numerous other persons we feel is just like building castles in the air. If we are not secured and you decide to go into ventures that will equally not aid that security, what are you doing? You're just building castles in the air. First thing first, we must be secured. Next thing, we must be unified so that we don't go back to the issue of insecurity. Then thirdly, every other thing becomes a product of these two things. When you are secured, when we are unified, when we are secured and we are unified, apparently the end result is prosperity. So this is the message. This is the message. Please take this message and take it with all sincerity. Give it out to people who do not have the privilege of listening to us this night. Once again, I am very grateful and I equally pray for the unending wisdom that the governor has used to propel the affairs of Kogi State this far. Thank you.